Everyone. Thanks for joining me for the next in our Step Up Your Safety series. Today we are talking about documenting the details and trying to make OSHA record keeping as easy as possible for all of you. I'm Kelly Marshall. I will be your host for today's session. A couple of things before we get started. You've probably already all noticed you have entered the webinar with your phone and your computer audio muted. It will remain on mute for the duration of the session. However, if you do have questions that come up, you can enter those using the Q&A function at any point in time, and we will go through those as time allows at the end. If we aren't able to get to your question, or if you have something that comes up after the webinar has been completed, please feel free to reach out with those as well. Let's get started. Today we're planning to talk a little bit about OSHA's record keeping and reporting rules, talk through some specific examples of injury reporting scenarios, talk through the options for reporting incidents to OSHA, and then follow up with some OSHA compliance assistance resources that you can take with you as you work through your own record keeping and reporting for the upcoming year. So to start, what does record keeping versus reporting really mean when it comes to OSHA? So OSHA indicates that recordable incidents are those that should be logged by you as the employer. This is typically what we're talking about when we refer to the 300, the 300A, the OSHA log. Any covered establishment must submit OSHA injury and illness data by March 2nd of the following year that covers the year of data. So for example, calendar year 2024 that we're just about to wrap up here in a few weeks will be required to be submitted to OSHA by March 2nd of 2025. Any recordable incidents are those that are on-the-job injuries or illnesses that require any kind of care beyond first aid. These are required by OSHA to be maintained by you as the employer for a period of 5 years. And it's required of any employer with more than 10 employees and in an establishment that's not classified as partially exempt. Partially exempt includes those industries in lower hazards like retail, service industry, insurance, real estate, and so on. These can be found on OSHA's website under Appendix A if you have any questions about whether or not you should be maintaining an OSHA log. Employers that are required to keep that OSHA 300 log are also required to post a summary of those injuries and illnesses from that previous year from February 1st to April 30th. Even if you don't have any OSHA recordable cases, you must still submit and then post that OSHA log. Current and any former employees who may be looking for that information have a right to access injury and illness records. There is lots more information about this on OSHA's website under their injury and illness record keeping and reporting requirements. On the other hand, an OSHA reportable incident is a very specific incident that is required to be reported to OSHA within a certain time frame. We'll spend some time talking about those as well. So let's start with those recordables. An OSHA recordable under their record keeping regulation is any of the following listed here: all work-related fatalities, any injuries and illnesses that are work-related and that result in things like days away from work, restricted work, transfer to another job, any loss of consciousness, or any medical treatment beyond that requires first aid only. It also indicates that significant work-related injuries or illnesses that are diagnosed by a medical provider or another licensed healthcare professional be recorded, even if it doesn't meet the criteria that we just talked about, like death, days away or restricted days from work, or medical treatment beyond first aid, or loss of consciousness. If a medical provider has diagnosed some sort of an injury or illness, it's required that you record that as a work-related incident. OSHA's definition of work-related injuries, illnesses, and fatalities are things where there's an event or an exposure in the workplace that either caused or contributed to a particular condition. In addition, if there's any kind of an event or an exposure in the work environment that would have significantly aggravated some sort of a pre-existing injury or an illness, this would also be considered by OSHA to be work-related. Injuries are things like cuts, punctures, fractures, strains, sprains, amputations, and they define illnesses as things like something that could be either acute or chronic, such as a skin disease like a contact dermatitis, for example, a lung condition or a respiratory disorder like an occupationally induced asthma, or some sort of a poisoning like a lead poisoning or a solvent intoxication, for example. Again, much more can be found on OSHA's website. More answers about what is really recordable as deemed by OSHA. There's a very specific detailed guidance for their injury and illness record keeping rule on their website. On the flip side, OSHA requires employers to record and also report any injury or illness that results in the following listed here: any kind of a work-related fatality, an injury, or an illness. We'll talk in more detail about some specific examples and the rules that go behind reporting these particular incidents. But oftentimes the question is really what the purpose is behind collecting that information. So not only can this help you better manage your own occupational safety and health programs at your workplaces, it helps OSHA to understand what's going on in the workplaces and to better prepare their own inspectors, not only to know what they should be looking for when they're out doing on-site inspections, but also then be able to use that data to help direct their own efforts at mitigating those hazards and keeping our workplaces safe. OSHA does also make a special note that the purpose of collecting this information is really not to have any kind of an effect on your workers' compensation program or to prove any violation of an OSHA rule. The hope is that it reduces the stigma that sometimes employers might feel about recording or reporting any kind of a work injury or an illness. So that's a super high level, quick overview about the difference in recording and reporting. We'll spend just a little bit of time talking about the steps that require you to think through what really constitutes an OSHA reportable or recordable. In simple terms, it's fairly easy. So the question starts with, did you have an employee that experienced an injury or an illness? And if so, is that injury or illness something that's work-related? Next question becomes, is that a new case? And we'll talk through the actual definition per OSHA of what that means to define something as a new injury or an illness. And then does it meet the specific general criteria for this particular application? I've listed each one of these and the specific OSHA reference should you have any particular questions, as I know there's a lot of detail that goes into determining work-relatedness and what really constitutes an injury or an illness. But to start with, the way that OSHA defines any kind of an injury or an illness is simply as an abnormal condition or a disorder. As I mentioned before, injuries can include things like cuts, fractures, sprains, strains, punctures, amputations, and so on. Illnesses can be anything chronic or acute, and things that then again may be a skin disease or condition, a respiratory disorder, or some sort of poisoning. In making the determination about whether or not an illness or injury is work-related, OSHA says this: work-relatedness is presumed for injuries and illnesses that result from any kind of an event or an exposure that happen in the work environment, unless, of course, some sort of exception applies. We will highlight this in particular in one of the case examples that I'll share in just a few minutes. The question then again becomes, is this a new illness or injury? OSHA defines this as something that's, of course, never been recorded as an injury to that particular employee or body part, but they also further define this to say maybe it could be an injury that an employee could have experienced previously, but they may have recovered entirely from that particular injury to that same body part. So while it may not be something that's brand new, if they'd recovered fully, then OSHA would consider that to be a new case. And then, does the injury or illness meet the general criteria or the application to these specific cases? This is defined as follows. Any injury or illness is recordable if it results in the conditions that you see listed here. Fatalities, of course, days or restricted days away from work or transfers to another job, any medical treatment beyond first aid, any loss of consciousness, and any other significant injury or illness as diagnosed by a medical provider. It's also important to note that fatalities, amputations, loss of an eye, hospitalizations have some very specific reporting criteria. Any work-related fatality must be reported to OSHA within 8 hours. And any amputation, loss of an eye, hospitalization must be reported to OSHA within 24 hours. Additionally, if any of those conditions occur within 30 days of the incident, then those are also required to be reported to OSHA. If something were to occur later than that 30-day window, that no longer constitutes an immediate notification to OSHA. So how do we do that? When you have those conditions that need to be reported to OSHA, these are your options. You can call the OSHA hotline 24 hours a day. You can report to your nearest OSHA office, and you can also report 24 hours a day online at osha.gov. OSHA 300 logs, on the flip side, that need to be reported and recorded annually can be submitted online as well via OSHA's injury tracking application, often referred to as their ITA. Here you can manually enter your data, or you can upload a file. They also have electronic transmission of that injury tracking data if you have an application with that programming interface loaded as well. Any kind of questions, again, about the electronic submission of your OSHA logs, you can find that specifically on OSHA's injury tracking app page, again, on their website. They also have some samples and templates available if that's something that you're looking for and haven't done that in the past. If and when you do have an incident that needs to be reported to OSHA, you should be prepared to provide the following: the name of your business, the location and time of the incident that occurred, the name or names of any employees that were affected, a contact person and their phone number, and then, of course, a brief description of the incident. So in a nutshell, that's a very high-level review of recordables and reportables. We're going to talk through a couple of FAQs that you may have as well. So first, who's required to report? This is really in reference to record keeping, or that 300 log. So remember, all employers under OSHA jurisdiction must report incidents that we just talked about: fatalities, hospitalizations, amputation, loss of an eye, to OSHA. Even employers who are exempt from keeping an OSHA log are required to report any of those particular incidents. In addition, you're required to keep, to maintain, and to submit that 300 log if you have 250 or more employees and aren't in an industry that's considered to be OSHA exempt, or if you have 20 to 249 employees and are in an industry that's considered to be OSHA recordable and reportable. Again, those are all listed in Appendix A on the OSHA website should you have any particular questions about the occupational classifications of your own employees and who's required to report. If you have a company that has 10 or fewer employees at all times during the last calendar year, you're not required to keep OSHA 300 logs, unless for whatever reason you may have been informed by OSHA or asked to keep some of that data. Occasionally, they do ask that employers keep that data for a period of time on a somewhat random basis. Additionally, it may also be worth noting that in the case of a temporary worker, for example, whomever's responsible for providing the day-to-day supervision of that employee would be the one who's required to report any kind of an incident to OSHA. This question is really kind of about first aid and diagnosis of an incident of an injury. If an employee was treated in the emergency room, do I need to report the incident? The very short answer to this question is no. OSHA defines that inpatient hospitalization piece as any kind of a formal admission to an inpatient service of a hospital or a clinic for whether it's direct care or treatment. Treatment in the ER only would not necessarily be considered to be reportable if the employee was not admitted to the hospital. Even if, for example, an employee were in the ER overnight, if they aren't formally admitted to the hospital, it wouldn't be considered to be something that's a hospital admission and therefore reportable. Additionally, if an employee were admitted to the hospital for a surgery, like a carpal tunnel surgery, for example, in order for that to be a reportable incident, the hospitalization would have had to occur within 24 hours of that particular incident or injury. So it would really have to be more of a traumatic situation as opposed to a planned surgery. Scheduled surgeries that happen beyond that 24-hour window wouldn't be considered something that needed to be OSHA reportable. The next question is, what if I'm in a state not covered by federal OSHA, which may apply to a few of you? Many states do operate their own occupational safety and health programs for the private sector or the state and local government workers. So reporting requirements there may vary a little bit by state, although all states are basically required to be as good as OSHA. So if you have any specific questions, then you can certainly refer again to OSHA's webpage for the status of reporting requirements in your various states. The next question is about a motor vehicle accident or any kind of an accident should it happen on a public street. If the employee was in an accident on a public street, am I the one who's required to report the incident? And essentially, the answer to this one is no. You as the employer are not required to report an event if it happened as a result of a motor vehicle accident on a public street or a highway, except in a construction work zone, or if it occurred on a commercial or a public transit system, such as an airplane or a bus. Also, you are not required to report if it involved hospitalization for diagnostic testing or observation only. This kind of goes back to that ER question, if the employee wouldn't be admitted to the hospital and they're simply there for observation or testing purposes. That's not something that would need to be required as being reported to OSHA. So that's a lot of information, a couple of very high level FAQ types of questions. And of course, there are lots and lots of additional things that may come up for you as you're working through your logs to be reported for this upcoming year. I've listed here several different places where you can easily go to learn more. This will be provided in a follow-up as well once we've ended the webinar. But really the best source of any current information about OSHA record keeping requirements is OSHA's record keeping page. Here's where you can find all of that regulatory and compliance information, frequently asked questions, some of which we talked about, and others, any forms, any contact information, and training materials as well. You can also contact your OSHA regional office or area office. For those of you who may be in those state plan states, you can contact your state plan office. And there are also state consultation programs that can provide some additional information and assistance with your OSHA record keeping. And finally, there are also OSHA Training Institute education centers that are located throughout the country. You can find a more complete list of those and that information on OSHA's webpage. These centers provide training on safety and health topics, including things like record keeping, that's available to you as an employer and to your employees as well. So before we take a look at any questions that you may have, I wanted to just give you a minute to let you know what's next. As soon as we finish the webinar, you will see a survey link pop up. It is, I believe, 7 questions, so should only take you 30 seconds to a minute. And it really just helps us to better understand what's of interest to you and what you find beneficial so we can help structure our future webinar events. You'll also receive a follow-up email with a link to the recording of today's webinar and all of those resources listed that I just pointed out. We hope to see you again when we resume our Step Up Your Safety series in February. The next in the series is entitled, What's the Big Deal About Return to Work Anyway?, where we will talk about all of your burning return to work questions and what's important in the world of workers' compensation. So I'm going to take a quick peek at all of the questions that you have likely entered for me. One question is if the slides can be printed, and I think I've answered that question. These will be sent out to you, so you can certainly print these. I'll go back to the OSHA resources page for you in case anybody wants to take a picture or type in any of those websites quick as we finish up here as well. The next question is, if an injury or illness is not work-related, we do not have to record it, correct? And that's correct. OSHA is really concerned about keeping our workplaces safe. And so the injury data that they're tracking and that they're looking for is truly that's work-related. Next question is about hospitalization, and this is one that I did mention, and it can get a little bit tricky. What's considered a hospitalization? Going to the ER or an overnight stay in a hospital. And that's really the key, is that hospital admission. And someone could be, again, in the ER, and it could technically be something that requires them to be in the hospital, if you will, during overnight hours. But if they're not formally admitted to the hospital, then OSHA doesn't require that to be recorded as an OSHA reportable, since they wouldn't technically have been hospitalized. They would have just been seen and treated in the ER. There was a question as well about uploading CSV spreadsheets on the OSHA webpage for 300 logs. You do have some options. You can upload that information, as I mentioned. You can manually type it in, which might not be terrible if you only have a couple of things to record or report each year. And you can also set up that live feed. That would be something that needs to be coordinated just through that app transmission piece with OSHA. They do have some templates as well and some sample documents. So that way you ensure that you've got all of the correct headings and you're recording the right information, so that isn't something that becomes a problem for you at the end of the year, as we're all trying to deal with those year-end items and getting that correct information over to OSHA. There's another question about training documents or videos that RES specifically offers for different industries to be shared, whether it's you as an employer or with agents that are working with different employers. We do have a variety of both training documents, which you can find on the RES portal. This will be one of the survey questions. So if you don't have access to the RES portal or you aren't familiar with how to use that, please let us know and reach out. We have lots and lots of resources for employer safety, different posters that you can share and post in your workplaces, all sorts of tip sheets that are free to you to be able to use as you wish, whether it's print or send or share. Those are available to you at any point in time, along with some different videos. We do also have an online platform for e-learning that's available to our RES clients at no additional charge. So lots and lots, again, a huge library of resources across lots of different industries. If that's something that you're looking for and this is new information to you, please reach out. We would be happy to help you get the right information that you need that can help provide just some of those additional safety resources for your workplaces. This was a question, and I may have skipped over this one. If there are no injuries to report for the year, do I report? And that answer is still yes. Even if you don't have any injuries that would be classified as an OSHA recordable, you're still required to submit your OSHA log and to post that essentially blank log. So even if that number is 0, then kudos to you for doing a great job keeping your employees safe, but OSHA still wants to know that too. Question about just an injury and severity. Is a mild injury such as a cut that requires stitches reportable, really recordable on the OSHA 300 log, but not reportable, for example, like the inpatient admission? And that's correct. So this is kind of that differentiating line between what is recordable, i.e. goes on your OSHA log, versus reportable, i.e. requires a rather immediate notification to OSHA. So if this is something, again, like stitches, likely the employee could have been seen in the ER, for example, not admitted to the hospital, which is what would make that reportable. But it does need to be recorded as a workplace injury or illness if it was something that occurred at work. That's correct. I'm going to work through just a couple of additional questions here. And if I do run into some questions that look to be something that would be of interest to all of you, I will certainly include that on the follow-up as well. I know there are lots of specific scenarios that can apply. This question is about workers' compensation. If a claim is denied by work comp insurance but meets the OSHA recordable standard, does the employer still need to log it for the annual log? And this answer would be yes. So this is where it can sometimes get tricky, especially if you're trying to use your work comp information to then construct and compile your OSHA log. It may not always be a workers' compensation accepted claim. Without going down that rabbit hole, there may be a variety of reasons that a claim could have been denied by workers' compensation. But if it happened at work and it's deemed to be work-related and meets any of those standards, again, requires care beyond first aid, then that would still need to be recorded on your OSHA log. All right, last question here before we wrap up. Is an outpatient surgery a reportable incident? And that would be no, just based on, again, the nature of the timing. The carpal tunnel example that I gave may be the most applicable example here. If the employee isn't admitted to the hospital and they're simply doing essentially what would be a procedure like stitches, for example, then that would be something, again, if it was related to an incident that happened at work, then that would still need to be recorded if you're required to maintain an OSHA 300 log, but it wouldn't be something that constitutes an immediate notification or a call to OSHA. Once again, thanks everybody for attending today. Thank you for all of your questions. I will look through, and if there's something that we've missed that would be of interest to everyone, I'll make sure to include that as well. In the meantime, any other questions that you have, please send our way. Thank you for joining us today, and we'll see you next year.